I thank the gentleman. Mr. Marchant.
Thank you, Mr. Chairman. We're all going through tough economic times now. We're trying to reduce the federal budget, the spending cuts. It's what we've been sent to Washington to do. In these hard economic times, all of the government has got to find a way to work more efficiently, and the IRS will be no exception. What is the IRS doing on trying to stop fraud on this particular credit that's being requested, Ms. Ingram?
We have a two-prong approach, sir, on this credit. One is designed around non-refundable credit, the one that's going to more than 95% of the people claiming the credit, the business side, and an augmented methodology that we're using on the refundable credit side with the small exempt organizations who are employers. All the returns go through certain kinds of checks that are the same for both groups. And these involve filters and checks that are a comprehensive set developed based on all of our experience with other kinds of credits, including advice that we receive from people like TIGDA and GAO. And then on the refundable side, we add certain additional filters that might be particular to that type of community, that type of group, because those with the refundable side, we're pulling before payments made.
Yes, sir.
Mr. Marchant, if I may, again, while they're doing yeoman's work in certain areas, this is an Achilles heel for the Internal Revenue Service. You know, if they don't address problems, and especially in the refundable credit area at the outset during the processing of it, the moment it goes out the door, it changes the dynamic of the situation entirely, in that it costs much more to try to recover dollars that have already been sent out the door than it would to prevent them from going out in the first place. And so again, while this is a tax policy issue, and we touched on this earlier, if they could buttress up their math error authority the policies in both this area and elsewhere, that would allow them to prevent and make corrections to tax forms before they go out, as opposed to having to subsequently audit and or reach out to organizations and individuals who inadvertently received or erroneously received tax credits.
With the time I have left, the biggest concern I have about this tax credit was when the administration was selling this Affordable Health Care Act to the public, millions of small businesses heard the message that they were going to get a tax credit. They were going to benefit if they provided health care for their employees. Yet when we are given an explanation of this tax credit and given this chart, I don't know of a small business in my district that would look at this chart and say that this is a simple tax credit. And my biggest concern is that the compliance, the cost that it would take for a small business to employ an accountant to simply navigate through this chart and navigate through the qualifications, in many cases would far outstrip any savings or that they would get from the credit. So I think that it's a testament to the complexity of this, of the code, to say that 4.4 million people were told you might qualify by it, and 309,000 claimed it. Have you figured out what the average tax credit issued to an applicant that takes advantage of it is, Ms. Ingram?
I tend to be somewhat allergic to raw data, but it's several thousand, and it depends very much on the situation of that small business. I have heard from small businesses that they received 5,000, and I've heard from small businesses that it's been smaller. So it very much depends on where they land in terms of their size and the kinds of premiums that they pay.
Thank you very much.